Chris's parents remember him as funny, kind and caring. But at 13, he began hearing voices in his head and started to self-harm, often swallowing objects. By the time he was 15, his parents were struggling to keep him safe at home and admitted him to a psychiatric unit. But he died in the place responsible for protecting his life.
We knew he didn't want to die. He had his plans for the future. He had a lot to look forward to.
You hear all too often about the most vulnerable in society, but surely a child with mental illness, they must be the most vulnerable.
Chris began to experience mental illness in 2012 and was involved with local child mental health services. 2 years later, after prolonged periods of self-harm, he was admitted to Bethlem Royal Hospital in South London. Despite being on a ward with round-the-clock care, Chris continued to harm himself and was taken to accident and emergency several times. 6 weeks after being admitted to the hospital, he swallowed the cap of a deodorant bottle and died of cardiac arrest.
The coroner found the number of self-harming incidents on the unit here desensitised staff and that a lack of risk assessment and up-to-date care plan contributed to Christopher's death. The hospital has since apologised to his family and reviewed its procedures, but Christopher is one of at least 11 children to have died on psychiatric units in England in the 4-year period up to and including his death.
It does prompt the need for an urgent review into mental health services across the country, as we know this is not an isolated case.
Chris's short life was troubled, but his parents now live with the pain that it shouldn't have ended when it did. Sally Lockwood, News at 10.